Whenever anyone gets pregnant, it's all a worry. Okay, now I'm pregnant, yay, we're gonna have a baby. And then an ultrasound comes up during the process with their obstetrician, and things are maybe not so good, or a blood test comes back, and is there something we could have known? Or a couple didn't know they were both carriers of a genetic mutation that doesn't express itself when you only have one bad copy, since we normally have two. But if one copy's bad and one's good, we're a carrier. But if both couples have this condition, and they're only going to throw one or the other their copies, if they happen to throw both bad copies, that's all the baby gets. And they're abnormal. And one of the most common mutations across the planet, across all ethnicities, is the mutation that causes cystic fibrosis, which really damages lungs and intestines so people can't breathe or absorb nutrients. So to know whether a couple is a carrier before they would get pregnant, what we call preconception screening, is something the American College of OBGYN introduced back in 2001. Because we take care of many patients who have normal fertility, but they know they're carriers. So we can actually have the sperm and egg have a hot date in the dish, what we call in vitro fertilization, and embryos, maybe 1 out of 4 eggs will lead to a more advanced stage embryo that hopefully could work to form a baby, but we can test those embryos taking a few cells that will ultimately form the placenta and test them while these pre-embryos, before they're put back in a woman's womb, we can screen to see whether or not there's a mutation, 1 copy or 2 copies, and to whether an embryo is suitable to lead to a child that would be free of this disease. Now the problem is that many of our patients that we take care of to do this screening first discovered they were carriers because their first child was affected. And the whole point of the American College of OBGYN is to say, how can we avoid that problem? Since testing has become far less expensive, we can screen a couple before they get pregnant to know if there's even the potential for that problem. So we can avoid their first child being affected. And that's the point of pre-implantation testing for a specific condition or diagnosis, which we call PGD, or pre-implantation diagnosis.